It is my pleasure to share something that Catalyst has been working on that we see as a complement to the efforts of all of the other entrepreneurs in the space who've been building out solutions to address COVID. So it was sort of the first week of March, and I think March 8th was when I officially kept my son home from school. I think we kind of knew what was coming. And that week, it just didn't make sense for us to sit around and do nothing. As Catalyst, we've been supporting this space for so long. So we asked ourselves, what could we do? And one of the things we knew we could do was create a forum for health tech entrepreneurs to showcase their work. And on March 17th, furiously working over just, I think, 3 or 4 nights with our developers and our small team, we put up something called COVID-19healthtech.com. And we put up about 12 companies that we knew were working in the space. This was the first responders, if you will, to the emergency response. And we put up a form and we said, if you're working on a solution for COVID in health tech, tell us about yourself. Within a few days, we had over 139 companies come and tell us about what they were doing. Some were brand new companies that were starting from scratch. Others were large players who were pivoting with a new product or solution to address the pandemic. And this little blog site began to gain attention. We actually started to categorize these companies into some of the categories that you see there: the testing, mental health, behavioral health, diagnostics, analytics and tracking, AI, and more. And these companies kept coming and telling us about themselves. And Matthew, I think you want to show maybe the open calls. At one point, we even launched a mechanism to say, if you have a need as an organization or a government for a health tech solution to address the pandemic, you can go ahead and put out a call. And we tried 2 open calls, just quick summaries of needs. And we had, for the first one, through Brigham and Women's, over 100 companies apply. For the second one that we're running right now, we have another company that's already formed a partnership with an organization to address some aspect of this pandemic and to serve underserved markets. So we were really excited that we were able to make this difference with just a small website. So we went to Kathy Hempstead, again, all roads lead to Kathy, and we said, we're working on this space. We'd love to expand this platform to showcase these entrepreneurs more. And Kathy was extremely supportive. And we said, rather than go from a blog site, we want to do something a little bit more robust. And so today, for the very, very, very first time ever, we'd like to debut the new front end to this platform. And I think Matthew will take you through it more, but let me quickly set it up. And so we transformed this blog site into a platform that's a database backend that has the ability to search, filter, and find companies that are working specifically in COVID response. And Matthew will show you a few other exciting features.
Here is the old site, which actually is still up. And as you see, we created a series of categories. So if you wanted to look at diagnostics, all the companies we put on this, and this is a very simple Squarespace site, there is some information about the companies. There's a large number of companies in this database, over 300 in this site. And you see we have a little bit of information about each one of these companies, but it's not really that helpful. It's not really that searchable, that useful. So what we've built on top of some work that was previously done is what we're now calling our source database COVID edition. So couple of things to mention as we go through this. First off, we still have our announcement here. This is now open and available. You don't have to log in to see most of this. I'll explain to you what you do have to log in to see in a minute. But what we've done is we've taken those categories that you may have noticed before, and they're all in these bubbles here. As I said, we are still asking people to give us their information. So you can look at this announcement at the top here, and please, if you're working on a response, you're not in this database, let us know. If you're a provider, a scientist, a policymaker, or somebody else who's expert, again, please let us know. We are still gathering information here. But in general, what this side is the source database has a little bit of the news. You saw there was some news on this other side, some articles, some updates, even some videos provided. For example, here is a video. Actually, it's a bit slow today. I was going to show you a little bit of video here that is in the site. because when I get there, I'll show this the video that Indu presented at. Oh, that's actually not Indu, that's somebody else. There she is. This is Indu, you can see her presenting from her living room. All right, you get the idea. We're also able to have at source information is new and notable, so you can do this by various different categories. Here are some of the companies in the database. Here's some in data visualization. But we really get to the power of the database, which is to look at a range of different companies at one time. So let's say that you're interested in impact of an artificial intelligence tool to help with COVID. Well, you can go here and look at the and take a search. And this is searching on a bunch of tags we've done. Here are a number of companies. You'll see there are 64 companies who we have data on in this information about in the COVID-19 world. And here are a number of them. And if you wanted to see more, you just scroll down over the show more. So let's take one at random. This is Giant, and I'll show you a bit about how this works. So here's Giant. It's a company based in San Francisco. Brief description about what they do, and then here's what they have done in terms of COVID. So you'll see the company Giant and the product are actually different objects in the database, which means things like that if a company sells a product to another company, we can track the product between companies. But you'll see that this one is a product, which is the Giant COVID-19 emergency response assistant, and there's some discussion about the launch of the product, where it's deployed. And as you see here, it's tagged as a COVID product, and you'll see it's associated with the company Giant. So that's a simple way of doing it, but you can imagine it gets more complex. We also have more stuff in here, so some information about where you find this company, and that's all available publicly. So let's say you wanted to, I don't know, you wanted to know a bit more about this. We have the ability that you could follow this company. I want to follow COVID, and it's going to tell me, hang on, you can't follow COVID because you haven't logged in. So come and log in. Now, I obviously can register. I've already, as you might imagine, registered for this site. So I'm going to now log in, password finder. Now, if you log in, it takes you back to the beginning, I'm afraid. So I have to, it doesn't want to be immediately back to was. It's a little wrinkle of the site. But if I come back to Giant and say, okay, I want to know a bit about Giant. I want to follow them. Now I can follow Giant. So if I go to my little browser here, I'll say, okay, here we go. So I'm now following Giant, and I'm following Big Health. And as time builds, any updates to my activity, to Giant's activity, will appear here. Or I could say, if I'm done with this, I could mark it as, I could unfollow, or I could potentially stop following if I don't want to see more about that. So that's one way you might look at it. There's another way of looking at here, which is just to generally explore. And there are a whole range of companies. You can see companies all kinds of different ways. This is all of the companies that we currently have in the database, all of the products. But let's say I was interested in I don't know, in thinking about something that perhaps in the guise of I don't know, communications. I'll see there's a communication tool. Let's see if there's a communication tool in the database. And here we have a number of different ones. So for example, you could then drill down into all different, there are 12 different companies in this guys. So, you get the idea about how you could then drill in and find more information about particular companies that we categorize in that particular way. So you can still, of course, search in still more ways. You can search directly for a company. So let's say you wanted, I was particularly interested in Conversa Health, a company I know pretty well. Let's go take a look at them. Here is Conversa. They have a bit of information, a conversational AI and analytics platform. If you scroll down at Conversa, now I'm logged in, I can also see some people involved with Conversa. Mark Brzezinski happens to be the CEO. And I can see they have two products here. One is coronavirus health chats, which they converted early on, and then later on they built one for employees. So I want to go look at the employees one. I'll find some information here about the product. And I've even got website of the employee of the product itself. So I could now open that up, go off and look and see what their actual information is. It comes up. My internet is a little bit slow today, but there you go. Here's more information directly from the company. The last thing I'd show you is the concept of doing. It's the concept of doing. I'll go back to the main page. The concept of doing a search. So I can perhaps do testing. Better if I can spell. And I can either search by name, which will bring up, we know these companies because they have testing already in their thing, or I can actually search the whole database by keyword. So if I was to search by keyword, now, these are all the companies who somewhere, 30 companies who somewhere, beyond products, somewhere have testing, in their somewhere in their description. So Dispatch Health, for example, you may not have known about this. Dispatch Health was doing testing, and there you go. It's doing an inventory of testing equipment and testing capabilities in place. So a pretty robust way to look at all of that information within the database. And if I'm really interested in keeping this search going, looking at the products now. Let's say I want to look at the companies, all the different tests. For instance, it's Indu test or Everlywell, still believe it's at-home testing. Let's get checked. I can actually save this search. So I've got the 71 results search saved. And if I was to come back later and look at my saved searches, I'll see I have 2 saved searches. There's one for home testing last night, there's one for testing today. So that gives you an idea of some of the power of the ability to use this kind of a database to find out more and keep on track with what's going on. And as I'll end the demo there. But Indu, if you come back and join me, we have some strong ideas for what we're going to do to build onto this. Stop sharing my screen. There we go. We have some strong ideas for what we can do to increase our ability to make this even more user-friendly and increase the connection between users of the database and the companies who are in it.
That's right. Our big goal at Catalyst has always been to broker meaningful connections in the industry. That is the name of the game. And through our developer challenges that we're talking about today, our pilot programs, our industry tracking, it's always been about not just giving information to the industry, but helping companies find their partners and vice versa, and then really helping to distribute and have maximum impact of those solutions. So you'll see that this is not just sort of a Crunchbase kind of platform, but it's beginning to have the ability to follow companies, to save your searches. Soon we'll be rolling out the ability to sign in as a company to see who's following you. And we really invite every single stakeholder, whether you're an investor, a government organization, a nonprofit, and a tech entrepreneur, to come and to participate in this platform. So what some of you might know is that in, I think, 2011 or so, Matthew Holt was very instrumental in designing and launching our entire source database, which consists of over 5,000 companies and something like 6,500 digital health products in 19 categories across the globe. So that database is currently just an internal proprietary database that we use for a number of our innovation programs. But the vision and the goal is to transform this coronavirus-specific platform to include the universe of digital health solutions. And that is what we as a team will be working very hard on behind the scenes over the next coming months. And we really, really invite your participation and feedback. And I think Matthew showed you that at the beginning. Matthew, if you are able to share screen again, but if not, we'll be putting this link in the chat and sharing with everybody. But if you're able, there is a little form that says, if you're an innovator, please fill out information. You can also edit a company. We will, of course, monitor those edits in a queue and be the final administrators of that information. But you can log on as we speak today. And if you're not on there, get on there and let us know that you're working in the space. Thank you so much.